Good morning, students. I am Anmol Thakur, and in this video today we discuss about the bacterial diseases. Okay, so in bacterial diseases we discuss about the mode of transmission, symptom, and preventions and cures. So, in this first bacterial disease is pneumonia, that is a communicable disease. Okay, so first we discuss about the mode of transmission. Okay, so pneumonia is transmitted through air, or you can say that through sputum. Sputum is mixture of saliva and mucus. Okay, during infection. So, how we can define the pneumonia? Pneumonia is an infection in one or both of your lungs. Okay, it infected your one lung or both lungs. And what happened during pneumonia? In pneumonia, there is an inflammation of alveoli in the lungs. Okay, so alveoli are the main site for exchange of gases between blood and in the lungs. So there is inflammation, means swelling in that. Okay, so next is sign and symptom. What happened during pneumonia? What the symptoms seen in the body? So there is a high fever, shaking, chills, shortness of breath, increasing breathing rate. So these are the some common symptoms during pneumonia. Okay, the chest pain when you breathe deeply, or cough. Okay, so fatigue, muscles ache, nausea, vomiting, diarrhea. So these are the symptoms which is shown in the body during pneumonia. Okay, next is what are the prevention and cure. Okay, so one kind of antibiotic, that is penicillin. Okay, that is the common penicillin used to treat ammonia. Next disease is diphtheria disease. Okay, so what is diphtheria? It is an acute and highly contagious bacterial disease, means highly communicable diseases, which causing inflammation, means swelling in the mucous membrane, and inflammation of pharynx. The pharynx region is having lots of swelling. Okay, so what are the mode of transmission? Transmission through sneezing, means through droplet infection, from the skin lesions, means through the skin, or by cut or wound. Okay, or by touching the object. Okay, so next is what are the sign and symptoms? Basically infect children of 2 to 5 years of age. Okay, so during that time, the fever and weakness, enlargement of lymph nodes on the neck. Okay, so lymph nodes help to prevent from the infections. Okay, so there is a swelling in the lymph node. Okay, nasal discharge, high heart rate, that is the normal symptoms. So next disease is whooping cough, that is called pertussis. So, what happened during this disease? The mode of transmission of this disease is through air, means by discharge from the throat during coughing. Okay, so what are the symptoms? It mostly infect children's and affect the respiratory tract. Okay, so what are the preventions and cures? There is a DPT, that is the vaccine, triple vaccine, diphtheria, pertussis, or whooping cough, that is used during diphtheria and whooping coughs. Okay, so this vaccine, through these vaccinations, this disease is prevented in the children's. Next disease is TB, that is tuberculosis. The mode of transmission of this disease is through air by droplet infections. Okay, by coughing, sneezing, speak. Okay, so this disease is transmitted through air. But next is prevention. Symptoms. Symptom is coughing 2 to 3 weeks, coughing up blood, chest pain, fever, night sweat, feeling weak and tired, losing weight. These all are the symptom that is shown in TB patient. It generally affect your lungs. Okay, so coughing is the most common symptom. Next is prevention. Okay, there is a vaccine that is called BCG vaccine, Bacillus of Calmette-Guerin. Okay, it is a vaccination, and One antibiotic, streptomycin. This helped to cure the tuberculosis disease. Okay. Next disease is cholera disease. Okay, it is an acute diarrheal illness caused by infection of intestine, and it is caused by a bacteria that is called Vibrio cholera bacteria. Okay, the mode of transmission of this disease is contaminated food or water. Contaminated food or water means the bacteria present in your food or water, that is called contaminated food. Okay, and it basically infect your intestine, cause loose motion, vomiting, dehydration. Okay, so what is the cure of this disease is proper sanitation, means proper cleanness, keeping food covered, washing hands, anti-cholera injections. So these are the some cure to prevent from cholera disease. Again, one kind of disease is typhoid disease, that again transmitted through the contaminated food and water, that is contaminated by flies. Okay, so this again infect your intestinal part. Next disease is viral diseases. Okay, that is caused by the viruses. The common viral diseases are common cold, influenza, mumps, poliomyelitis, jaundice, rabies. These are the disease name. Okay, so one by one we discuss about these diseases. First is common cold. Mode of transmission is droplet infection. Droplet infection either through sneezing, coughing, okay, or contact with articles spoiled by nasal discharge. Okay, so this is the mode of transmission. What kind of symptom is there? Nasal discharge, headache, and mild fevers. Nasal discharge means the discharge which is coming from your nose, okay, during cold. What are the prevention? Avoid contact with the affected persons. Take proper rest or taking some kind of antibiotic medicines. Okay. Next disease is influenza. This disease again transmit through droplet infections by coughing or sneezing. Okay, contact with person, article of the patient. Okay, if some person touch the object and the non-infected person again touch that object, so virus is transmitted through one person to other persons. Okay, it basically infect your lining of your nose, throat, or upper respiratory tract. During this infections, patient feel chill, got high fever and body pain. Okay, what are the preventions is again avoid contact with to the affected persons. If you are not contact with the affected or infected persons, so there is a no diseases transmit from infected person to normal person. Rest to get well soon and take antibiotics during that time. Next is mump disease. Mump disease transfer from person to person contact. Of course, this is a communicable diseases. Okay, symptom is they basically infect your salivary glands. Okay, which secrete saliva. Okay, and below the ear and headache and high fevers. Okay, for prevention we take vaccine, that is gamma globulin, which protect from infections. Next is poliomyelitis. Okay, that is transmitted through droplet infection or by fecal matter. Okay, which is entered through the nose or mouth, and it basically attack the nerves. Okay, which controlling the muscles. So due to this, we got fever, headache, vomiting, drowsiness, muscle weakness, and sometimes it cause paralyzed, which is generally common in the children. And for their prevention, we got polio vaccine. Okay, so there does dose gives 6 week after providing lifetime immunization. So 3 doses are given in this to prevent the poliomyelitis in children's. Next is jaundice. Okay, it is transmitted through contaminated food and water. And what is the symptom? It basically infect your liver. It enter into the liver. Okay, and infect your eyes, skin, and urine that become yellow during that time, jaundice. Prevention is light food, proper medications. These are the some prevention to cure the jaundice. Next is rabies disease, and it is transmitted by a bite of a rabid dog or cat. So virus is present in the saliva of infected animals, and it transmitted and reach the brain and affect nervous system. What is the symptom? Drinking become painful. Because why they are painful? Because we fear from the water. Okay, and prevention, immunization of dogs. Wash the wounds with soap and warm water. Okay, and apply anti-rapid injections. Okay, you can wash your wounds and anti-infectant washes and soaps. So this is all about the viral disease. So please study well and be safe.